Hello, everyone. Happy Friday. Welcome to Conversations on Care, our Facebook talk show, where we bring together healthcare professionals, our clients, our caregivers, to help families better understand and cope with their aging parents and chronic care needs. My name is Julie Collada, and I am the founder and CEO of Open Arms Solutions. And Open Arms is a home care agency serving Chicagoland area focused on inspired home care solutions for seniors with chronic conditions such as dementia, Parkinson's, and other movement disorders. It is truly our mission to help families through this journey and to know that their loved one is living their very best life possible. As a reminder, if you find these dialogues helpful, please give us a like and a share so that it can reach more people who could really need this information. And if you have a topic or question, if you have a question or topic you'd like to hear more about, please write them in the comments below. So with me today is Nadya Northrop, founder and CEO of PharmD Insight. And our topic today is a heart-to-heart talk about medications. Great title for Heart Month.
Yeah, thank you, Julie, and thanks for having me on. I'm excited to talk about heart medications and medications in general.
Great. Yeah. So it's an important topic. We've never hit it on the program, and I am so glad that you're here.
Awesome. Yeah, my company's called PharmD Insight.
PharmD Insight. Perfect. Just a little bit of an intro about Nadya. Nadya received a bachelor's in business administration from Loyola University in Chicago, a master's in health services administration from the University of Wisconsin-Madison, and a doctorate of pharmacy, which I guess is also called PharmD, from Midwestern University. She has more than 20 years of experience as a community pharmacist and as a consultant pharmacist and owner at PharmD Insight. Helping patients reach their health goals is at the core of what she does. This includes identifying drug risk factors, adverse reactions, interactions, ineffective medications, and duplicate medications in the same drug family. Amazing background, important service. So happy to have you here.
Thank you. Happy to be here.
Nadya, can you just, to start off this conversation, share what inspired you to first go into into becoming a pharmacist, and then later inspired you to start PharmD Insights?
So I've always been kind of very math and sciencey, and my grandma was actually in pharmacy school back in Ukraine in like the late 30s, early 1940s. And then when the war hit, once it affected her area, she had to quit pharmacy school and she was never able to go. And I think she's inspired me in my life in many ways, but that's definitely one way. Another reason is I just absolutely love interacting with people and helping them. And so I needed a job where I had a lot of face-to-face interaction. And so I did that for over 20 years. At both Jewel-Osco as your friendly Osco pharmacist, and then
I saw that in your bio. Yeah.
Also at Lutheran General Hospital in their outpatient pharmacies. And then I just decided it was time to switch gears and start my own company and provide a service to people who really need it, and that's seniors.
Yeah, and congratulations on taking that leap. Of faith and having your own company. That's fantastic. And it is, I think you and I both know, being in this industry for as long as we have in healthcare, this part of healthcare, medication errors are one of the top reasons people get admitted to the hospital. So this is, such an important need. So
medication errors aren't just a reason for admission, but they kill over 100,000 Americans every year.
Well, there you go.
So you really want to know what you're on and why you're on it.
Yeah.
make sure you're on the right stuff.
We'll get to all the other things that you have to think about and need to know, and that's when you need to consult a professional like yourself. So, as I mentioned before in the intro, February is Heart Health Month. And what advice, Nadya, would you give to older adults about keeping their heart healthy and getting the most out of their heart medications?
So happy Heart Month. The first advice I have is, make sure you're taking the medications that your doctor prescribed for you, and you're taking them the way your doctor said. A lot of heart disease is just keeping control of numbers, and those numbers, we don't feel sick, but things can be going on. For example, high blood pressure is called the silent killer. Cholesterol, you can have high cholesterol and never realize it. So it's important to get your checkups with your doctor, get your blood work done, know your numbers, and then take the medications that your doctor gives you to keep those numbers under control. Prevention, what is it? An ounce of prevention is a pound of cure. Yes. Prevention is so key in heart disease, and we're finding that more and more, more than ever. And then you want to stay on those medications as best as possible. If you find that you're having a side effect, don't stop the medication. Don't suffer through a side effect if you think it's bothersome. Call your doctor. Sometimes you can have a telehealth appointment. Sometimes you don't need an appointment. You can just leave a message with the nurse, and the doctor might even change your medication to a similar medication in the same drug family that might not have that side effect. Sometimes they will want to see you, but oftentimes that can be done as telehealth if they've already diagnosed the problem. So you might not even have to leave your house if it's cold and we're getting snow today. So if it's nasty weather, you can probably, and then there are other things you can do. We need to try to manage our stress. We all have stress in whatever way, it hits us, right? And so trying to manage stress can mean, learning some meditation, learning some deep breathing techniques. That's also something you can do from the comfort of your home. And oftentimes you can do that at no charge. You can just find a website. There's so many websites out there. There are apps. A lot of them are free, or at least the basic level is free. And then they try to entice you to buy up, but you don't have to do that. And just, some really calming, deep breathing exercises, because and it doesn't matter what kind of heart disease issue you have. It's really important to manage stress if you have something like high blood pressure, because the two can kind of be related sometimes. But you can have high cholesterol, and it's still good to manage your stress, because anytime you're managing stress, you're giving your heart a little bit of a break. It's less intensity on the heart, and that's always going to be a good thing. The other thing that's been in the news a lot is alcohol. It used to be widely recommended as super, super heart healthy, red wine specifically. And now there's some controversy about that. I always like to follow, the idea of doing things in moderation. Mm-hmm. So I'm not a proponent of stopping your red wine forever if you've been, having a little bit every day or every other day or whatever, but in moderation, Right. And then there's, eating a healthy diet,
like exercise, all those important things. Yeah.
Oh, and another big one now that's been in the news in the last few years is dental hygiene. So they found that you want to make sure that you are preventing gum disease, because if you get gum disease, it's bacteria, and then there's usually, an area where the gum tissue is compromised, and the bacteria can get into the bloodstream and
all sorts of really important things to think about for heart health. Absolutely. What is polypharmacy, and why is it a problem?
So polypharmacy is it's defined as taking 5 or more medications regularly. And those medications don't all have to be prescription. They can include drugs that you can buy without a prescription. Basically, yeah. And
you're talking about supplements and things like that too?
Well, no, not supplements. It's just really drugs. So a lot of drugs are available now that weren't available years ago. A lot of stomach remedies like Prilosec, Pepcid, that kind of thing. And it's a problem because it can, the more things you're on, the greater the chance you're going to have more side effects. And the more things you're on, the greater chance that the medications are going to interact. And that's then where we see it affecting people's health, and oftentimes can be a reason to end up, in the hospital.
Sure.
Polypharmacy is actually considered a diagnosable condition now. So it actually has a medical coding system attached to it.
Well, that's interesting. So just to better understand that, it's the definition is 5 or more medications?
Regularly. So, basically.
Regularly. And that's coded, and that's how do you manage that differently? How do you reduce that risk if you have people that are on 5 or more medications? What do people do?
So the first thing you want to do is double check that all of them are necessary. And as we get older, and it's a contributing factor to polypharmacy, is that we tend to develop new conditions, right? Things just don't work like they used to. And so, our blood sugar may have been fine in our 30s. Now, when we're in our 70s, we might be getting, the early stages of diabetes, for example. Same with, like I mentioned, blood pressure, cholesterol. Well, just those 3 diseases alone all have to be treated with different kinds of medications. A cholesterol med is not going to lower your blood sugar. So it's pretty easy to accumulate those medications. And just because polypharmacy is defined as 5 or more, 5 is actually pretty manageable. But I see clients sometimes that have a dozen or more medications. And that's where it gets really, the whole issue of side effects and drug interactions. I mean, just imagine how many different things can happen when you're on that many medications. So you want to make sure you have somebody, either your doctor or a pharmacist, look over what you're taking. Something I find is that when I meet with clients is that people are taking medication for years and years and years, and they don't know why they're still taking it. So if you have high cholesterol, high blood pressure, diabetes, those are conditions that pretty much have to be treated for life. But a common one that is a common medication that people are on for years and years that maybe don't need to be on is something I had mentioned earlier, like Prilosec, which is used for GERD, which is heartburn. And sometimes that's a condition that doesn't last forever, and you can get off of that. So you want to see if there are any medications that you don't need anymore. You want to see if there are any duplications in your medications. And then the other thing is, sometimes there are medications that you can take that are 2 medicines in one tablet or in one capsule. So you're swallowing less, you're remembering to take less because they're packaged together.
That's interesting. So I think the lesson that I'm getting out of this, and certainly is we take care of seniors, right? We specialize, as I mentioned in the intro, we take care of seniors with multiple chronic conditions. And when you have multiple chronic conditions, you have multiple medications.
Yes.
And so medication management, and for many of our clients, medication reminding is so important, because you have to clearly be very consistent and vigilant about taking medications. And I'm sure that you would support that. One of the things, sometimes we'll go in and we'll do an assessment for a family, and they'll have their medications. We'll go in and there'll be all these pill bottles. There'll be like 8 to 10 pill bottles. And, and one of the things that we're required to do, because we're licensed by Illinois Department of Public Health, and that's a great thing, right? They say our caregivers aren't allowed to just take medication out of a pill box. We've got to make sure that families have them organized in a weekly organizer. And that's so important too, because most of our clients at some point, most of our clients are over 75 years old. And there's some short-term memory challenges. So the message, number one, is make sure you have someone like yourself if their loved one or they are on more than maybe 5 medications, have someone really talk to your pharmacist, talk to a consultant to really determine, do you need to be on all these medications? That's number one. So that's really important.
Right. And then, as you mentioned, the pill organizers, I'm a big proponent of making sure that your medications are organized, because the problem with polypharmacy also is that it's just too many directions to follow, right? If you just are responsible for one medication, you take it every morning, most people can remember that. But if you're on 5 or 10 or more, it gets really tricky to develop a good medication regimen. And a lot of people need help with that too. Doctors are really busy. Unless you're a patient in like a concierge practice, doctors are expected to see a certain number of patients per hour at a lot of the large, like large medical groups.
Yes.
And they just don't have the and that's not really their expertise anyway. They're there to figure out what's wrong with you and figure out how to help you get better.
Sure.
So it's important to have somebody sit down and make sure that you've got a good, you have your medication regimen organized really well, because it's crucial to take those medications on schedule and take them correctly.
Thank you for that. That's so important.
Yeah.
So how does a person know if there are 2 drugs that do the same thing, or if there could be, negative interactions between those drugs? What's the best way to approach that?
Again, it's a good idea to have somebody, a professional sit down and look at all your medications. Sometimes people do have to be on 2 drugs that treat the same condition, but they should never be on 2 drugs in the same family. That's like almost never. So, for example, high blood pressure is a good example. When somebody's diagnosed, doctors will choose a particular blood pressure medication. And then, a month or 2 later, they'll recheck the blood pressure. They'll check for side effects. And if the doctor still isn't happy with the control of the BP, they will usually add a second medication that works a little bit differently. And because medications work differently, even for the same disease. And so one medication will help lower your blood pressure in one way. Another one might be like a diuretic that helps you get rid of some extra fluid. So you want to make sure so that's okay. But if you were on 2 medications that work exactly the same way, that would not be okay. And that's an example, though, a really good example of, back to polypharmacy, sorry, I'm getting a phone call. I got distracted. I apologize.
No.
The blood pressure medications, that's a really good example of having two different drugs in the same pill, in the same capsule, or in the same tablet. So yes, you're on 2 different medications, but at least in terms of remembering to take it, you're not going to forget to take one if you take the other, because they're both together.
Well, that's first time I've heard that. Good to know.
Those are little pharmacy tricks.
Yeah. I've heard that some type of medications are not good for seniors. Can you talk a little bit about that? Is that not true?
That is true.
That is true.
So if you go to the American Geriatric Society website, I believe you'll find it there. There's a whole list of medications. It's called the Beers list. Beers, like the drink. It has no relation to alcohol, the list, but the doctor who developed the list, his last name was Dr. Beers. And so that list is medications that doctors should try not to prescribe for older adults. Some of those medications on that list, people do have to be on, but you want to try to avoid them as much as possible. And some are not even prescription medications. For example, pain relievers like aspirin and Advil. You should not be using aspirin to relieve pain. The only time you should be on aspirin is if your doctor tells you you need it for some form of heart disease treatment or prevention. And then Advil is also one that can cause some issues. It's not nearly as, I don't want to use the word dangerous, but aspirin, definitely you don't want to be using for pain control. Advil, you can use short term sometimes, but it depends because Advil can raise blood pressure. And another thing is that as we get older, our kidneys don't work the way they used to when we were young.
Mm-hmm.
And Advil can be pretty hard on the kidneys. And you have to make sure you drink lots of water when you're on it to be, to protect your kidneys. And so for pain control, for example, usually the best thing is Tylenol. Mm-hmm. And then there are other medications that are on that list, that Beers list, some allergy medications that, and this is stuff you can just pick up at the store, right, without a prescription. Benadryl, for example, is one that we've probably all heard of. We all grew up with Benadryl.
Sure.
Benadryl can lead to, especially in the elderly, sedation, blurred vision, confusion, and that then becomes a huge fall risk. And falls are horrible. They're dangerous.
Yes, they are.
And falls affect the independence of a senior. So, I'm huge about fall prevention because
I saw that on your website, and it is. I think those of us in this industry are all passionate about, doing everything we can to prevent that fall. Because
right.
Once a senior falls and breaks a hip, it's just such a challenge.
Exactly.
So this great information, and this Beers list, I don't know, actually, ironically, our producer's name is Chris Beer. I just had to say that. Sorry, Chris. And so can you put in the, Chris, for people so they can see, I don't know if you can Google it. Is it Beers, like B-E, like the beer, BEERS list.com?
Yeah, if you Google Beers list, you'll find it. And again, I'm not saying that you should never be on these medications. Just that the recommendation from pharmacists and from the American Geriatric Society is that doctors should just really think twice before they prescribe them.
Well, that's a good, that's great. Listen, we're all trying to learn to be more of self-advocates, and we want our clients and our patients to advocate for themselves. So that's a perfect example, and that kind of information allows people to do that. So that's great. So what are some good questions to ask the doctor when that doctor prescribes a new drug?
Yeah. So if it's a medication, it's new to you and you've never had it before. First, of course, you want to know what's the brand name, what's the generic. Sometimes there is the brand. If it's really old, the brand name doesn't matter. You can just know the generic name. But if you can find out both, it's probably a good thing. And, ask your doctor. Don't be afraid to talk to your doctor. Ask your doctor, so what are you prescribing this for? What do you think is the medical condition that you think I have, and why do you think this will help me? And the other thing you can ask is, what other treatment options are there, especially if you're already on 10 medications, for example. Before you add that next medication, you might ask, what is the chance that I might try a non-drug option for a couple weeks? Now, if you have an infection, don't do that. You're going to need the antibiotic, right? But in some cases, there might be some ways that the doctor might be able to, a good example is they might be able to prescribe physical or occupational or speech therapy to help with the condition before they prescribe a medication. And then the other question you want to ask is, how long do you expect me to be on this medication? So again, if it's an antibiotic, for most people, that's a very short course. It's like a week to 10 days, maybe if it's a bad infection, 14 days. But back to, and I don't mean to stress blood pressure and cholesterol that much, although it is Heart Month. If it's blood pressure, cholesterol, blood sugar, those you can pretty much expect to be on forever unless you can really get those conditions under control. And that's harder to do as we get older. It's not impossible, but it's just harder. And sometimes things like cholesterol, if you want to change your diet, that's great. And I firmly believe that that's something you can try. But the reason our cholesterol goes up as we age is not always what we eat. A lot of that is also the fact that your body makes cholesterol. Cholesterol is necessary in certain amounts in your body to help make tissues and things in your body. But if you have too much of it, then it becomes dangerous.
That's important information.
Oh, wait, let me tell you. And then there's questions for the pharmacist too.
Great.
So can't forget the pharmacist.
No.
When you're picking up that medication at the drugstore, you want to ask, what kind of side effects should I expect? What are okay side effects? Like a mild headache, for example, might be something you might experience every once in a while, hopefully not all day. That would not be okay. And then what are side effects I have to really be concerned about? And are there any drug interactions I need to be concerned about? How long until this medication will start working? Will it start working with the first pill I swallow, or is it going to take a few days? That's really important with antidepressants, because antidepressants actually can take 4 to 6 weeks before they're really working at their best. They start to work a couple weeks in, but you don't get the full effect until 4 to 6 weeks in. And then how do I know if it's working? Sometimes that's not so easy, right? If it's your cholesterol, you have to go back and have it retested.
Right.
Test. And then can I take it at the same time with other medications that I'm on? Or do I have to space it out? Those are questions I would definitely say to ask.
Those are great questions. I when I pick up medication, most of the time, not always, but most of the time, the pharmacist will say, "Do you have any questions?" And I will say no. But these, you've armed us with some things to think about, and great questions to ask the pharmacist. So thank you for that.
And unfortunately, the pharmacist is usually super busy.
Yeah, they are. Right.
But you want to try to get at least a few questions in that you can.
Yeah, but I think being prepared with what the questions are, I imagine they will, best they can, take the time to answer them. So that's the self-advocate part of things, right?
Absolutely.
We can't wait for the pharmacist to think of the questions. We've got to make sure we know what the questions are to ask. So thank you for that. That's great.
Yep.
We just have a couple minutes left. Is there, in our discussion today, you mentioned examples from your clients. Would you tell us more about what you do for older adults? What would your service, if someone's listening to this and they're concerned, they know they are or their loved one is on multiple medications, they have some concerns whether they're doing things the right way. Can you tell us more about your service and how to engage with you and your company?
Sure. So you can go to my website, www.pharmdinsight.com.
Great.
And you can see what services my company offers, and learn more about me. And the reason I started this company, Julie, is because even if you do get 2 minutes at your drugstore with the pharmacist, that's not a lot of time, right? And so if you're younger and you're on one medication, 2 minutes might be enough. But if you're, again, an older adult and you are, you do have polypharmacy and you are taking a lot of medications, it's a good idea to have somebody look at them all. And so what I do is I come into the home, and I look at all the medications that the person's on. So that is prescription, non-prescription that they can buy at the store, any kind of vitamins and supplements, and echinacea and melatonin and stuff. And then I look for side effects that can be troublesome. I look for interactions that can be dangerous. And then I do a lot of patient education. I make sure the person understands what they're taking, why they're taking it. Oh, I also look, of course, for medications that they don't need to be on anymore that we could possibly try to get them off of. And I make a really nice medication list for them that's accurate, it's up to date, and they should take with them everywhere they go, because you never know when you might need it and somebody might need to know what you're taking. And then I also leave them with an after visit summary when I'm done that tells them exactly what they, pretty much what we discussed during the session. And then if they're going to follow up with their doctor, what they should tell their doctor. And then I also do a different visit that's a fall prevention visit, looking at the fall risk based on what medications they take. So I'm not a physical therapist or an occupational therapist. They look at fall prevention from a completely different angle. I look at it as, what medications are you taking that can cause confusion, dizziness, blurred vision, where you might not see a very slight change in the floor, something like that. And then, and trouble with balance, any of that. And then also make recommendations for that. And another thing I do with my current clients is, if they've been in the hospital or in a nursing home or rehab, when they come home, I do what's called a medication reconciliation visit, where we look at what medications they're no longer supposed to be taking, because medications get changed when you go into the hospital, especially,
Right.
to make sure that they're on exactly what they're supposed to be on. And then the last thing I do, we touched on it earlier, we were talking about the pill organizers, is I offer a service where I come into the home every 2 weeks and I fill those pill organizers. So I do a 2-week supply, and it really helps people stay on track. So that's
great.
Pretty much what I do. And I will say I have found things, I've found interactions and other issues. And so, it's not a good thing, but it's a good thing, because it definitely reinforces in me the need for
for what you do.
business, right?
Yeah, absolutely. Well, based on my experience working with families, if someone doesn't have the ability to do it themselves, then I think then what you offer is really, really fabulous. We're out of time.
Darn it.
It goes fast.
It does.
Excuse me. I want to thank you so much, Nadya. It was a pleasure talking with you. Great information. Why don't you say your website one more time, how people can contact you?
Okay. Yeah. Thank you so much for having me, Julie.
You are so welcome.
I'm going to spell it out. www.P as in Peter, H as in Henry, A apple, R Robert, M Mary, D David, and then the word insight, INSIGHT.com. www.PHARMD insight.com.
Perfect. Okay. Thank you so much for what you do, and look forward to working with you, continuing to work with you in this area, and make referrals to you, because I think it's a great service.
Thanks so much, Julie. Thanks for having me on, and happy Friday. Have a lovely weekend, everybody.
Yeah. Thank you so much. You too.
Thanks.
Bye now.
Bye-bye.